Endometrial tuberculosis and infertility. After the endometrium is infected with tuberculosis bacteria, it undergoes damage similar to curettage, resulting in scarring, adhesions, and even endometrial shedding. Menstrual flow significantly decreases or ceases altogether. Tuberculosis causes adhesions throughout the entire uterus, not only in the cervix and uterine body but also in the openings of the fallopian tubes. The incidence of this disease is currently on the rise, while it was very low in the past 2 to 3 decades. Now there is an increasing trend, and everyone should take it seriously. Endometrial tuberculosis is part of systemic tuberculosis or pelvic and abdominal tuberculosis. It never occurs solely as endometrial tuberculosis. If other sites are unaffected, it is not possible. It may be a component of pulmonary tuberculosis, peritoneal tuberculosis, pleural tuberculosis, or pelvic tuberculosis. Therefore, once there is a history of tuberculosis and a confirmed diagnosis, especially in cases of tuberculous peritonitis. If after tuberculosis treatment there is reduced menstrual flow and infertility, endometrial tuberculosis is highly suspected. In terms of treatment, for mild cases, surgery can be performed to separate the adhesions, followed by the placement of a uterine shaping device to restore the uterus to its normal form. For more severe cases of endometrial repair, there is no effective treatment. We can only resort to endometrial transplantation from another individual. If successful, that would be ideal. If not, alternative options such as surrogacy can be considered to have biological children. Some may wonder if anti-tuberculosis drugs are necessary. They are not needed because these are all sequelae of tuberculosis. It's like having a scar on your hand. Although it's called a scar, there is no point in taking medication for a wound that has already formed a scar, because scarring has already occurred. Endometrial tuberculosis is a sequelae of tuberculosis. Taking anti-tuberculosis drugs is not meaningful, further medication is not required. We are only focused on repairing the endometrium. Beijing Antai Hospital implements contracted treatment for this condition.